Yeah, thank you for joining me on TMI. COVID-19 vaccine arrival, efficacy and rollout measure is the crux of today's discussion. And doing this big one talk with me, starting from my immediate left, I have a senior registrar in public health, University of Benin Teaching Hospital, Dr. Chinyere Uwaogugu. Thanks for joining me, Dr. Chinyere.
Thank you for having me.
And next to him, I have a senior lecturer and the Deputy Director Research Laboratory, University of Benin, and he is Dr. Osaitin Igaro. Thanks for joining me, Dr. Gordon.
Thank you. Nice to be here.
Well, we've been following the trend, and Dr. Cyprian Ngan became made history by being the first Nigerian to really be inoculated alongside a plan for the headline workers to be the first in all of this. But what are your reservations, Dr. Chinyere, over the vaccine that has been brought to Nigeria? What are your reservations and preference?
Okay, I would say generally, I think that like other countries were doing, like South Africa and Ghana, I think we should have done more studies, okay, to ascertain if the vaccine will be best fit for us, okay? I think, yes, it's a good thing to welcome the vaccines because we've had 1 year of the COVID-19 infection, we've had deaths, we've had cases, we've had isolation cases and all that, so it's a welcome development. But I think we should have, stepped back and done more research. At least we have researchers in Nigeria, we have doctors, we have scientists, we have lab scientists, should have done more research before rolling out these vaccines. But I still say it's a welcome development.
Okay, yeah, it's good you're telling this because we had the challenge where in Austria and in South Africa, they placed a halt on the rolling out of the vaccine.
Yes.
Okay, but you are a researcher and deputy director of the Central Research Lab, UNIBEN, the lab scientist. What do you make of this AstraZeneca or Oxford AstraZeneca vaccine? Is it right and appropriate? Like she said, investigation should have been done properly before receiving it. What's your thought?
Yeah, like the other time when we came here, we talked about vaccine also. And I made it clear that in a case where the risk and the mortality rate is very high, you could, as a contingency plan, by way of responding to the emergency, you could accept a vaccine on the basis of analysis of risk and benefit. So it would be better for very highly, cases with, in incidences with that we have spotted high mortality. To be better for us to administer a vaccine that has been proven to be valid and efficacious.
Okay.
With the mind that you want to tackle the high mortality that we are having, to manage the incidence first. Then, and that's the benefit that people that will take it might get from taking the vaccine will be better than losing these people. Then, and I also made it clear that while we accept the vaccine and administer the vaccine, we can establish cohort studies that will now help us to go further into how do we, in Nigeria particularly, respond, how we responding to the vaccine. What are the outcomes of the vaccination?
The side effects.
The side effect, yes, when you talk about outcome now, the side effect, the benefits, and the side effect. Okay. So this can also be initiated, and perhaps it can concurrently be established or can go together simultaneously. It will not be too safe, in my own opinion, to outrightly reject the vaccine and wait for our own internal studies before we start administering the vaccine. Ordinarily, we could have also set up our own panel of scientists to follow up with stages of development of the vaccine and see that, those people that developed the vaccine, they actually followed manufacturing protocol for vaccine development. There is a vaccine process technology that may have been that has been followed for this vaccine to be produced. And for the WHO, European Medicines Agency, to approve the vaccine for use, certain protocols must have been followed. And relying on that, we could accept the vaccine in Nigeria.
Okay.
Then we now establish follow-up studies to observe and do clinical trials and findings about the outcome, whether positive or negative.
Okay, looking at what you just said concerning outcome, either positive or negative. Now, the COVAX brought this free of charge, and we're looking at about 3.9 million doses, almost 4 million doses. And looking at this, Nigerians, or some Nigerians have these reservations or this thinking that it could come with side effects, and they wouldn't want to be victims of whatever could come up, because we have in Austria where it was said that one person died and another took ill immediately after taking the Oxford AstraZeneca. What's your perspective?
Okay, for the cases in Austria, I know I heard about it, I read about it, and the case that was ill had some coagulation issues, and studies don't say it's unrelated, okay, to the vaccine. Now, vaccines generally have side effects, and the side effects are based on the site of injection, okay, and also the body's response to the vaccine, showing that, okay, this vaccine is effective. And for COVID-19 vaccine, it's not far-fetched, okay? You would have side effects like muscle pain at the point where the vaccination was done, slight fever, slight chills, and headache. Those are the major side effects, if any, that would occur, okay? Now, but in rare cases, like studies that have been done, it's said that some people may have allergic reactions. And that reaction is not because the vaccine is bad or is not effective. It's because these people, on a good day, have allergic reactions to COVID-19 itself or anything related to it. So they are saying, and these studies have been done in the US and in Britain, they are saying that, okay, if you know that you have a known allergic reaction, you should tell your doctor before receiving this vaccine. Now, in Nigeria, we don't know of any of such people, okay? And they may be rare and they may be far in between. So generally, the side effects are minimal. Very minimal, and they are not known to cause overt illnesses. So,
okay.
Yeah.
Still on the Oxford AstraZeneca vaccine, because that's basically it. And we have this challenge where reports have it that it offers about 10% protection for mild to moderate COVID-19 disease. Is that significant to be used by Nigerians?
10% protection? That report, I think I can challenge that report.
Okay.
The Oxford AstraZeneca vaccine there was a stock before these vaccines were rolled out. About 23,000 participants were enrolled into a study and to do the baseline investigation as per reactions and all that to the vaccine and efficacy. But March 2021, that's this month we are, the report that came out now for Oxford AstraZeneca vaccine for the elderly that it was administered to. The elderly of around 80 years and above, because they were given priority based on their age. Now, the report says that it offered protection, or let's put it in a more scientific way. It reduced risk of hospitalization and certain form of complications like respiratory distress, coughing and all that by up to 80%.
Okay, but don't forget, it's preventive, not curative.
Immunizations and it has preventive medicine, basically preventive medicine. Okay. The issue of cure, there are people that have had a COVID-19 infection and they recover from it, for example. So the issue of bringing a drug that cures it, that's not what we are talking about. We are talking about helping the body to develop higher immunity to the infection. And that's what the vaccine wants to offer. Then for someone that may have that's already showing symptoms of respiratory distress, airway toxicity or airway infection and all that, this study showed that when these people were vaccinated with the same vaccine that we have in Nigeria now, they had advantages or benefits from the vaccine with respect to clearance of other complications that are symptoms that will look like COVID-19 symptoms. And they were able to benefit from the vaccine and have recovery of at least 80%.
Okay.
If, for example, 100 people were given the vaccine, up to 80 or 79 had positive benefit from the vaccine.
Okay.
So that is to say the vaccine has protection.
It can offer a high percentage of protection
to the virus with respect to mortality and the morbidity or pathological outcome, or let me say symptoms that may come out from the infection.
We have other vaccines like the Pfizer, BioNTech, the Moderna. Looking at this comparatively, what do you see as more potent?
Well, from studies, it's been said that the Pfizer biotech is actually more potent, okay? But it's just that, of course, the various vaccines have their positives and their negatives, okay? And I would say that for the AstraZeneca vaccine, one of the positives is that it can be stored at the regular temperature that our usual vaccines that we use for childhood immunization are stored. That's +2 to +8 degrees centigrade, okay? And so that's a plus, especially for low-income countries like ours, all right? So that's a plus because we vaccinate children and we actually store these vaccines adequately and they come out potent. So if the AstraZeneca vaccine can be stored at that regular temperature, it means that our problems of storage and our problems of storage facilities, it's reduced because we have these facilities already. We've been storing other vaccines, and so we can store these ones, okay? Now, that doesn't mean that the AstraZeneca vaccine is not potent at all. Like he said, it actually offers over 60% protection. Okay. It has 60% efficacy, okay? Yes, even though the Pfizer biotech has higher, but the AstraZeneca has over 60% efficacy, meaning that it can prevent people from people from being sick, people from being admitted, reduces hospital admissions, reduces complications, okay? And so if it does all that, I think we are moving ahead in curbing the mortality and morbidity patterns of COVID-19.
Okay, if it can protect infection transmission, like you just
not infection transmission.
Okay.
Not transmission.
Okay.
The illness. That me progresses to the point where I'm coughing seriously, I'm having chest pain, I'm having difficulty with breathing, and I have to be admitted. It reduces all that. Yes. Okay. Now for transmission, because most vaccines don't even prevent infection. That you are taking a BCG does not mean that you don't have the tuberculosis bacilli in your system. Do you understand? If you do a Matthews test, it will show that you have that bacilli, but you're not coughing. You don't have tuberculosis, which is the disease itself. Oh, yeah. Do you understand? So that is what this COVID vaccine is. The same thing, that I have the virus in me, but I'm not presenting with an illness. Okay? So the studies are still limited because these vaccines have just been rolled out. More studies have to be done to see how much it reduces transmission and how much it reduces infection. But what is known for now is that it reduces hospital admissions, reduces complications, and reduces illnesses, which is morbidity and mortality patterns.
Well, I think it's quite interesting.
What we should look at, sorry, to just add to what she said now. Okay. You know, there is a difference between infection and disease. It's when the immunity of the person is not able to handle the infection that a disease comes out. So disease and infection, they are not equal in biology or in medicine. Are you getting me now?
Disease and infection. They don't mean the same thing.
They don't mean the same thing. So by the time people interchange the word, it's not too good. It will be misleading. Okay. Now we are on air. We need to know that disease, for somebody who has the infection, is different from the person who has the disease, the full-blown disease with all the accompanying symptoms. Are you getting me now? So, but the direction we should go, too much ado about nothing. The direction we should go now is that the vaccine has come. Rapid or quick response with respect to getting some funding from CBN, from TED Fund, Federal Ministry of Health, to quickly set up some research with respect to what has come. And the people we are giving it to get our own locally generated data. This is where we should be going to. Not issue of should we. If you are not taking the vaccine, if you are not accepting the vaccine, you do your own. Prepare your own. Set up a vaccine. Okay, is there an established vaccine process technology that is yielding results in Nigeria? That is result oriented, that is having products. So it's not issue where we should be humble enough to, accept what has been prepared. But we should not be complacent to what? Going deep into investigating what is the local data that could be generated from research with respect to accepting this vaccine.
Okay, Dr. Chinyere, you said earlier concerning need for proper investigation to be done. And in that direction, like with that of Godwin Igaro. What do you make of this vaccine? Because presently, some people are in doubt if it can really tackle the other variant of COVID-19. Perhaps eventually comes upon us.
Well, even in the high-income countries, there's still a doubt as to how it can attack other variants of COVID-19, okay? But I think that we should focus on what it can attack. And then further research will now be done on, okay, can it, because I don't even think we've done research as to the other variants present right now in the country. So I'm doubting
the other variants present.
Yes,
right now.
If there are, do you understand?
We
don't. We are not even aware.
Okay.
We just take hook, line, and sinker. Okay, UK has a variant. Okay, we are suspecting that. Okay, maybe we have a variant. Do you understand? Like you said, we don't even have funding as to people doing. We have the manpower. We have the knowledge. Is to now get the funding to start doing research. What other variants do we have? Okay, now we have the vaccine. People are taking it. Who are those with newer variants? Are they responding to this vaccine? All those are questions that we need to answer. We cannot just answer them by reading the news and reading what other people have done. Yeah. Because you understand, there are, for genetic makeup, there are various factors. Our genetic makeup as Africans is different from those in the Caucasians and the Mongols and all that. Okay. And we saw that last year in the first wave where those in Italy, Spain, France were dying rapidly, and we were not. So you can see that our genetic makeup is different. It's different. So we cannot be taking hook, line, and sinker the research done in all these countries and not do us as to whether we have other variants, how many they are, and whether this AstraZeneca vaccine would help. Okay. Do you understand?
Okay, what are your nudges in the direction of the federal government really mobilizing effort in this direction?
The federal government has to be more proactive. We are happy that the vaccine has come in, but we should not just stop there at administering this vaccine. Like my learned colleague said, we need research to be done, okay, on the vaccines that have come, on the responses to the vaccines, okay? And then if, like you said, these vaccines are also effective against newer variants, if there are newer variants present in the country, okay? We have manpower, we have the skills, we have the knowledge. The federal government should make use of this manpower, of these skills, and see how they can synergize efforts and do more research.
Okay, what's your advice to Nigerians who may be itching, urgent in terms of receiving the jab of Oxford AstraZeneca?
As quickly as possible. If it comes to Benin, I will be able. It's already in Benin anyway, based on news. Yeah. I've not seen.
Okay, well,
if it comes to my locality,
we are hoping to receive it.
They said they have given state governments. They are
it's available.
Okay. So now, when it comes, it's like what we have been yearning for. The constraints, the limitations of COVID-19 have been much. The impact have been much on homes, families. So now we are looking at way forward, and one of the earliest way forward is the vaccine. So when it comes, all Nigerians should quickly take, and they should give priority to health workers who are the front line of handling the cases. Then, of course, the elderly.
Okay, some are also thinking that some persons may be disadvantaged not getting it or not being prioritized because of this online registration portal.
Okay.
So, do you think that aspect of online registration portal could also be a setback for some? Because even the those with disabilities, persons with disabilities, are also saying that they seem to not be prioritized on the list.
Sir, you don't make a basic need. At this point in time, we are in a pandemic situation. The access to the vaccine becomes a basic need, as basic as water, hair, and all that. You don't make a basic need to be accessed through sophisticated means. It's like you are telling somebody to, before you drink water, log on line. Okay. Before the person log on line, the taste and all that. Now
and a lot of persons may not have access to that, like in rural areas.
Bring it as localized as you will bring the other childhood vaccines. Come to churches, come to villages, and administer this thing. Forget online things. What's online? Some people have touchline phone. They can't do online. Why are you bringing a sophistication into what is an emergency? There's no need for that, in my own opinion.
Okay, your final thoughts on this?
No, but I think that we're over 180 million in Nigeria, and just 3.94 million vaccines were brought. So it means that not everybody can get it.
No, this is just the first dose.
Even in the US, in May. Even WHO has a recommendation for priority cases. Okay, where you have the healthcare, the front line, even the healthcare workers, not all healthcare workers. It's talking about the front line healthcare workers, other healthcare workers, elderly, and those with comorbidities. Okay, and also the vaccine has not even been shown to be efficacious in those less than 18. So now they're saying from 18. Do you understand? So I'm sure that in Nigeria, by following those guidelines, to give the priority people, but that does not mean that the other people will not be prioritized. As more vaccines come in, I'm sure other people will take. Okay. But the funny thing is that the Nigerians that are talking are not ready to take these vaccines. If you ask the average Nigerian, they're scared, they're skeptical and all that.
Of what the side effects
or what the side effects may be like. People feel like it's not coronavirus, we have not died from it yet. Those who are healthy and all that.
Some see it as glorified malaria, like
so
one of the governors
I think as more vaccines come in, I'm sure they would now become less priorities and all that.
Thank you so much for taking our time to be part of this show,
No
Dr.
problem.
Chinyere Uwagogo.
Thank you so much.
Dr. Chinyere Uwagogo is the senior registrar. The senior registrar of public health, University of Benin Teaching Hospital. And big thanks to you, Godwin Igaro. Godwin Igaro is a senior lecturer and deputy director research laboratory, Central Research Lab, University of Benin. Well, this is the much we can take on this segment. We'll be extending the frontiers of this discussion as the time goes on. We'll take a short break. Do stay tuned.